It's a pleasure to welcome all of you to a very important session at the Raisina Dialogue. It is a session that's focused on social safety nets for all. I'm absolutely honored and privileged to be joined by an extraordinary panel. Let me quickly introduce you to them. We have Minister Smriti Irani, Minister of Women and Child and Textile also. We have Mr. N.K. Singh, Chairman of the 15th Finance Commission. We have the CEO of Niti Aayog, Mr. Amitabh Kant. And I'm also joined by a colleague of mine, Shriyana Bhattacharya from the World Bank. And my name is Junaid Ahmed. I'm the country director of the World Bank. Why are we focusing on safety nets today? We know that we're in a world of shocks and uncertainties, the pandemic, climate change, and the continuous technological changes that are ongoing. In a world of change, we know that those who are poor and vulnerable are in effect vulnerable. And by vulnerability, we not only talk about those just around the poverty line, but above the poverty line. And any shock to an economy pushes people into the poverty line. The axis of vulnerability is not just defined by income. It's also defined by many other criteria, such as gender, such as those who are physically challenged and challenged otherwise, and of course those who are aged. But safety nets is not only about the poor and vulnerable; it's also about the workers of a country. Especially during shocks, we know what happens is that the workers lose jobs. They're looking for jobs, and the society needs to protect the workers at that point. If possible, even to prevent them from being left out of the workforce. At the same time, with technological change always happening, workers are seeking to upgrade their skills, and a safety net must also invest in their ability to build up their human capital. The pandemic, the COVID-19 crisis, made all of this, unfortunately, very clear in a very stark way. And India responded. India responded with its social protection system. In the rural area, Manrega. It responded with direct benefit transfers, cash transfers, especially to women-headed households. It also triggered its PDS, food distribution system, which worked in a very powerful way. And India used its technology and its ability to identify people. But India also discovered a lot of fault lines inside its own social safety net. First, it recognized that perhaps urban India had not been covered fully. It recognized that maybe the migrants were not fully covered. At the same time, we know that India has a huge informal sector. 90% of the urban workers are in the informal sector who are not covered by social protection or social safety net of any kind. And even more important, India needed to coordinate its federal system. I think that India is facing a watershed moment where it is going to take its old social safety net system and in responding to the pandemic has moved into what I believe the beginning of a global class 21st century social protection system. What will it take for India to move into a social protection system that's pan-India, where social benefits are portable, where it covers informal sectors and truly protects the poor and vulnerable, and ultimately is one that is driven by a coordinated federal system? What will it take India to create such a 21st century social safety system? Well, I'm hoping that our panelists will give us guidance on that. Let me begin with Minister Smriti Irani to begin with. Minister, namaskar, good to see you again. If I may ask you, Minister, you have a very tough challenge. You are leading the country in terms of the whole area of women and child. During this pandemic, how have you seen the gender differences emerge as a result of COVID, and how has government responded to these gender differences?
Junaid, thank you. I think in your opening remarks, you have presumed a position that how will India get to a position where there is a pan-India network administratively, which does enough justice to the social sector challenges that a country as diverse and democratically as large as ours. I think India is already well on its way to creating that network, and one of the greatest examples that we saw thrive was when the Prime Minister pronounced in 2014 the Jan Dhan Yojana. It was not a program that was directed towards the better gender, if I may say that. I think that the predominant view at that time was to ensure that there is access that our citizens have to financial services and formal financial services. The gender impact of that was such that women's savings accounts, as you know well, went from around 28% to above 40%. Many at that time had said, what is the use of such a facility given to those who have been disenfranchised with regards to financial services thus far? And I think that the pandemic, in fact, brought to light how that became a very powerful instrument administratively, where over 220 million women had access to direct cash transfers from the government's treasury worth 30,000 crore. So there have been many government projects which are not possibly in terms of proclamation gender inclined, however, have had a greater impact with regards to gender. For that matter, if you look at Manrega spend, now year to year, the spend for Manrega increases at an estimated 1 to 2%. However, when the pandemic hit, the government announced the Garib Rozgar Yojana under the Prime Minister's leadership, and you saw that the budgetary increase went from just a year-to-year 1% increase to, in the pandemic, increase from a budgeted stage to a revised stage to up to 81%. And what was the gender impact? The gender impact was such that 53% of the beneficiaries were women. Now, if you juxtapose that with the active participation of the female Indian in the workforce, those numbers actually do not in any way meet. So I think the irony is such that numbers, especially under programs such as Manrega, tell you that irrespective of whether a program has been set or an agenda or a policy has been propagated, has a gender component or not, the government is extremely sensitive to the gender needs of our society and ensures that an equal opportunity to get those benefits are given as much to women. Another example, Junaid, is of the Ayushman Bharat Yojana. Now, today we can very happily say that over 40 million cardholders are predominantly women. Now, when you look at the gender and the social impact of the same is, many women in our country, and I'm sure Sharanya will possibly agree to what I'm saying, that when we spoke about issues like breast cancer or cervical cancer, let's say 6 years ago, most of the gender discourse was such that women predominantly in our rural areas would not have either access to such facilities, or for that matter, these were not issues that were popularly discussed societally or familiarly. And I think that one of the takeaways from the Ayushman Bharat Yojana as a woman, I think something that I celebrate, is that in the past 2 years, we've seen 24 million Indian women, especially in the rural belt, screen themselves for breast cancer. 16 million women screened themselves from cervical cancer. That included the help that women received during the pandemic from programs like Ayushman Bharat, from programs like Jan Aushadhi Kendra, which made healthcare facilities more affordable for them. So as I said, India is well on its way to ensuring that gender justice is met through policy and administrative interventions.
Minister, I think what you've just shared is extremely important. First, these cash transfers to women, I don't think there's any other country that has been able to leverage this kind of cash transfers directly into the hands of women. But you raise another very important point, which is in a world of non-communicable diseases, India stepping forward in dealing with the impact of NCDs and taking care of the gender dimension. These are very, very important elements of what you're calling the emergence of a pan-national social protection system. Maybe if I can ask you, Minister, to reflect a little bit on your other portfolio, equally a challenging portfolio, Textile. And Textile covers so many different aspects: the growers, the middle traders, and of course the textile MSMEs directly. During this pandemic shock, how has government created a support system for the textile sector?
I think much can be said about the Prime Minister's not only administrative acumen, but also he envisages challenges in the future and how we can prep for it today. And just like I had spoken about the Jan Dhan Yojana, I think with regards to textiles, there are two prominent issues that I'd like to flag. Firstly, under the Textiles Ministry, we have the Cotton Corporation of India, which is a public sector undertaking, which on the ground implements the MSP operations in the cotton sector. Now, Junaid, if I just give you a comparative between economies which were not hit by the pandemic, which is, let's say, 13-14, and the pandemic year, the MSP operations in cotton in the year 2013-14 was a measly 90 crore rupees. However, the MSP operation across 28 states in the pandemic year went beyond 26,000 crores. And the difference was that in the year 2013-14, you had the middle person, many who know a prominent phase now after the agricultural reforms called the Adatiyas. They were taking the money on behalf of the farmers in the year 2013-14. However, we in the Textiles Ministry, in collaboration with our colleagues in Ministry of Agriculture, took a decision 2 years ago that we will ensure direct transfers into the bank accounts of farmers across the country when we undertake the MSP operations. And the result of it is that in the pandemic year, again, leveraging the direct transfer scheme of the Modi government, we ensured that every farmer received their monies within 48 hours. So that being said, while that is a protection of the farm base with the textile sector, you look at the PPE suit story of manufacturing. Now, in India, in the month of March 2020, we did not have a single facility. How the Modi government works in terms of convergence, I think manifests itself best in the PPE story. We had the Ministry of Defense turn around its DRDO labs so that most of the textile units could have sampling and testing done in those labs. We went from one lab in Coimbatore in the month of March 2020 to 9 labs by the month of April. We had the Ministry of External Affairs collaborate with the Ministry of Textiles and industry at large to ensure that if there is a machine tool need for manufacturing of PPE suits, we identified industries in various countries, irrespective of the fact that international borders were sealed. In collaboration with Ministry of Civil Aviation, we flew down those machines and those raw material needs of the industry were fulfilled. So we went from 0 company in March to 1,100 companies in June. And in a pandemic year, where not only were international borders sealed, but the lockdown also sealed transit and movement of goods and people, we generated 500,000 jobs. And the industry in those 3 months stood valued at $1 billion. So we reoriented manufacturing processes. And I think that this became an example of Indian tenacity, apart from the good governance, which is the Modi mantra.
Thank you, Minister. I think you represent, in many ways, the bridge we're talking about in social protection, not only about protecting the poor, but also protecting the human capital.
So just both to add, Junaid,
yes.
70% of those who work in these segments are women. So the PPE story was actually women-led in terms of manufacturing.
I think this is a very, very important story that needs to be told even more. And maybe if I can turn to Shriyana, because Shriyana, I think you're going to confirm many of the things that the minister has pointed out so forcefully. The Pradhan Mantri Garib Kalyan Yojana was the Pradhan Mantri's real push to support society at a time of a downturn. Many implications were raised by the minister, but you led a team that looked into the impact of this program. Share with us a little bit what we're finding from the ground.
Thanks, Junaid. And let me start by echoing what the Honorable Minister said, which is this response to the pandemic has had a very important female face, not only in terms of the bank accounts, female-headed households, but also livelihoods groups, community kitchens. When state disaster response funds were being used to provide materials and relief at scale, women's groups played a very crucial role in the delivery of these particular benefits. So that's a very important part of the story. When we do a survey over the last year with our partner CMIE on a survey which tracked what share of households receive benefits, it's important to remember, Junaid, the point that you started with, which is in India, nearly half the households are between the poverty line and twice the poverty line. And this means that a social protection response not only to the pandemic, but to any shock in the future doesn't just need to focus on the poor, but also to workers who are very close to the poverty line. And when you look at the data from PMGKY, we essentially find nearly 90% of all households in India received at least one benefit from the package. This was largely driven by the public distribution system, also the state disaster response funds, which were triggered such that states could use those monies flexibly and provide support, and also the direct benefit transfer accounts into the Jan Dhan accounts, which were done at scale, and many other countries are now trying to learn from the Indian experience of how this was done as quickly as it was. Having said that, while the scale of support was extremely large, there are three important structural fault lines when you look at the PMGKY response, which essentially echoes and emphasizes what we know about the Indian social protection system broadly, comparing it with other countries such as a Brazil or a Mexico or a Turkey or a China, large federal context. The first, Junaid, is exactly what you again started with, which is if you look at coverage of PMGKY, what we find is rural coverage, particularly for cash transfers, was far higher than in urban areas. And this is not because there was significant effort, it's just that the social protection system in India tends to focus on rural instruments. So you have a rural Narega, you have a rural PM Kisan, and now we have new urban schemes such as the Swanidhi that's just been announced. But the urban corollary to these large rural programs that can be used to immediately trigger supports is still being designed and scaled up. And there's a second aspect to it, which is currently if you look at programs that operate in urban areas, they essentially run precisely the way they do in rural. So if you look at the benefit transfer amount, say for a social pension, the 700 or 500 rupees that are going in an urban area, given the cost of living and inflation, the value of that amount is very different, say, from a city in Delhi vis-a-vis a village in Bihar. So I think one of the key lessons comparing India's response to other countries is while transfers were at scale and significant, when it comes to cash as well as social insurance for workers, in urban areas, there needs to be a more mission mode focused scale up of the safety net system. The second aspect is while the payments chain and the direct benefit transfer mechanism was extremely strong, and I think the Honorable Minister put out how quickly benefits were transferred, one of the issues that emerged was that the current application cycles for schemes are not dynamic. So you can't quickly include people who may have immediately faced a shock into a particular program to provide them benefits. And if you look at a Brazil or a Mexico, these other countries have invested in using technology to create what we call social registries, such that technology can transparently target people in a dynamic way. And you no longer just have a fixed cycle of the application window for a particular scheme, but it opens up throughout the year, thereby allowing governments to much more dynamically respond and target and identify beneficiaries better. And the third and final point, which is broader than just the pandemic response beyond PMGKY, if you look at the landscape of social protection in India right now, the direct benefit transfer mission officially identifies 390 direct benefit transfer schemes. These are discrete schemes which have their own individual delivery chains and application cycles, without currently a nodal ministry or agency that coordinates across them. And if you compare this again to, say, a China or a Brazil, you find that these countries tend to have a nodal accountability framework, either through a council or a committee, whereby different ministries that administer different kinds of social protection programs can coordinate better. And the other issue is that if you look at this 390, and this is something that has been raised in the economic survey as well repeatedly, we find that actually 62% of financing and 65% of beneficiaries belong to around 6 or 7 large cash transfer programs, which then begets the question about how do we better simplify and streamline the remaining 300 odd programs where there's a fair amount of duplication, and there might also be costs for citizens to try and access these different benefits at different times. And so one of the lessons coming out of the PMGKY experience is while payments were made at scale and the public distribution system served nearly all households in the country, not just the chronically poor, but the lower middle class as well, What's important is to create a coordination structure which can improve targeting through potentially registries, start to rebalance the urban safety net story, and third, coordinate, consolidate, and potentially convert some of these large fragmented 390 scheme, the architecture that exists. I'll stop there, Junaid. Over to you.
Shreyan, I think this is a very important story, how powerfully Pradhan Mantri's Garib Kalyan Yojana actually had an impact at scale, and not just at the poverty level, but above the poverty level. And during a moment of shock and crisis, which affects more than the poverty level, this kind of a program is extremely important. But you then raise the issues that there are now some systemic points which, if India addresses, it enters into a completely new social protection system. And I think that's a question that I'd like to ask the 15th Finance Commission chairperson. I was actually shocked to hear this number, 350 schemes, but maybe 65% is only in 6 to 7 programs. Did the 15th Finance Commission look at this fragmentation and to see whether the schemes ought to be consolidated? Was that part of the work that you did? And to what extent did you address in the 15th Finance Commission the whole area of social protection?
Well, thank you very much, Junaid. First of all, let me say that the Honorable Minister, I think that brought out very sharply the recent initiatives taken under the Prime Minister's leadership, not only in strengthening the entire social security protection system in India, but in the multiple ways in which it has also benefited from a gender point of view, the women population in multiple ways. I thought that her examples were quite telling in terms of the flexibility with which the social protection system has been managed. So I fully agree with all the things which she has said. I want to comment on 3 different but related issues. First and foremost, let me comment on the issue of social protection, what we need to do to strengthen it, and the broader issue which relates to migrant and migrant workers. Because one of the things which was brought out very sharply during the earlier phase of the pandemic was the movement of migrant workers. So I will divide my comments evenly between the first and the second. On the second, of the issue of whether the 390 schemes which were mentioned by your colleague, whether we looked at it or not, yes, we very much did. In fact, that if you see that there are some very robust recommendations which the Commission has made in regard to the centrally sponsored schemes. Now, this sounds a nice nomenclature, but all this comes in some way or the other as a sub entry with multiple ministries spanned over with small amounts of money, which he rightly pointed out really cover so many of these kinds of schemes in one form or the other. So we made some rather serious recommendation. Amitabh knows this well. He was part of the process. But I'm happy to say that not only did we go into this in great detail, but he made recommendations which have been accepted by the Finance Minister in her budget speech. And that exercise is currently underway by the Ministry of Finance, Department of Expenditure, on a much better rationalization and amalgamation of these centrally sponsored schemes. So the answer to your sharp question, Junaid, is yes, we looked at it, we made recommendations. These recommendations have been accepted by government, and we should see the implementation towards a much more rational, orderly regime. There was one more point which was raised by your colleague in respect of this. I think it's a very worthwhile point, that initiatives in this regard are really scattered in over multiple ministries and multiple organizations. I completely agree that we do require perhaps a coherence of those efforts into one ministry or one nodal entity, perhaps under the leadership of Madam Smriti Irani, since she has taken all these initiatives, which can put together a much better symmetry between these initiatives, which currently span large number of entities and organizations. I'll now move over quickly to, unless you want me to address that, Junaid, separately, to the issue of migrant workers and migrant worker policy deserves a fuller treatment. I could do so now, Junaid, or I could wait for second round, because I do want to say something about the entire issue of migrant workers, since it dominated the public concern during the earlier phase of the pandemic. Stop here and wait for your response.
I will come back to you on that because it is a very important part of the discussion. But if I could bring in Amitabh into the conversation. Amitabh, from the Niti Aayog's perspective, perhaps you could comment on two things. One is is the whole issue of targeting. Safety nets require effective targeting. And how do you see technology playing a role in helping India target better? And second, your perspective on the sort of the threshold we have reached where coordination can really push India into a very different league in terms of a social protection system, which is a question I'm going to come back to the minister also. Amitabh, over to you.
So Junaid, I think that's a very important issue that you've raised, because if you look at over the last decade, very rapid advancements in both digital and telecommunication technologies have resulted in a very tectonic and a very permanent shift in our labor markets, both in formal as well as informal sectors. And Shreya mentioned about our ability to provide security net in the rural areas, but not in the urban areas. And one of the key challenges there is that access to affordable smartphone and cheap internet has really led to the creation of short-term, time-bound, on-demand job opportunities. And, this, in my opinion, the gig economy is part of a very crucial transformation occurring in today's work landscape. And the gig workers, consisting of self-employed, freelancers, independent contributor, part-time workers that form a part of, they are forming a backbone of a very vibrant micro-entrepreneurial ecosystem in India. And therefore, close to nearly 24 million jobs in skilled, semi-skilled and shared service roles would be delivered through this gig economy. And therefore, we need to understand this, that in the urban areas, this will be a very, very crucial challenge for India, because Mr. M.K. Singh talked about the migrant workers. And this, in the urban centers, we've really seen the emergence of successful gig economy models. And my belief is that despite the pandemic, the perception towards gig is largely unchanged and will actually get accelerated, since with the lifting of the lockdown, people will recover jobs and incomes. And therefore, a key lesson that has emerged during the last 1 year of this pandemic is that we need to make social protection available for gig workers. We must create safety nets and institutional capacities to protect gig economy participants from unemployment at the time of crisis, and the lack of employment rights and various other social protection measures such as health and retirement benefits deter many from being an economic contributor. And we need a very, very holistic policy framework. The key aspect, of course, is from a social security net is that the only way to do this is today to be able to use technology. I worked in the traditional fisheries sector of Kerala, where, many years back when opening a bank account was a nightmare. It used to take 8 to 9 months to know your customer, and you had to chase bank managers. Today, you are able to open a bank account in less than a minute on your mobile. You are able to transfer money straight into the bank account straight, and therefore across all government schemes, every single beneficiary-oriented scheme, we must use technology to leapfrog and put the money directly into the benefit, into the bank account of the beneficiary, much like what PM Pradhan Mantri Jan Arogya Yojana is doing. I mean, look at it. It's the biggest health insurance scheme across the world, 500 million Indians. And you can move from Kerala to Tamil Nadu, or you can move from Bihar to Tamil Nadu. You will carry your insurance scheme with you, and the money will get transferred there. So I think the answer really lies in using the JAM Trinity, using the bank account to really push this across all the government schemes. And secondly, using technology, in my view, will be a very powerful tool in the post-COVID era. We should increasingly strive to develop very powerful technology products and tools on a private-public collaboration model, where government should only act as an enabler and push this in a very big way, both for, create technology platform to digitally enable livelihood access for, blue and grey collar workers in India, and then ensure that transfers, all social security benefits get transferred only digitally and only digitally, and that will be the biggest contribution we'll be making in India.
No, thank you, Amitabh-ji. I think you're absolutely right about the role of technology in really bringing social safety nets to everyone, and I mean everyone, and as you point out, the gig workers in particular, because even before the pandemic and the climate shocks, technology changes have really reshaped the gig economy, and the gig workers are clearly a very, very important part of the human capital of India. Minister, if I could turn back to you, everything that we hear suggests that India has all the tools on the ground, whether it's social insurance programs, whether it's the Garib Kalyan Yojana, whether it's elements of technology, but there seems to be a sense that this may be a moment to do something that you're doing very effectively in the Ministry of Women and Child, which is you're creating a platform to bring all the women, all the programs that enable women empowerment, to coordinate them across ministries, across government. Do you think this kind of a coordination is needed for the social protection programs? And if so, how do you think that can be brought about?
I think if I just reflect on Ms. Bhattacharya's interventions with regards to amalgamating efforts in terms of policy and implementation on the ground, one must recognize, Junaid, the vibrancy of our democracy is this, that we have multiple agencies and multiple ministries to serve the larger cause. Now, when I say that, what do I mean? In your opening remarks, Junaid, you spoke about the portability of the benefit system in a country as diverse and as large as ours. One of the greatest examples of that is, apart from the programs that I have enunciated, is even a program like One Nation, One Ration Card. Now, in the union budget, where the finance minister read out the benefits of it, I remember distinctly she spoke about 690 million Indians now have access to that one ration card, which is portable across the country. So if you reflect again on what Mr. Kant said about the gig economy and the workers who get impacted by it, and if you look at the numbers that the 2011 census had thrown up, that in the migration analysis of our country, about 46% of our citizens who migrated, one of the predominant causes of migration was not employment, but marriage.
Yes.
And it impacted 97% women. Now, when they migrate to a new facility, what are the 2-3 things that they seek? One is, of course, access to affordable food, which One Nation, One Ration Card now ensures. The other is access to good health facilities, which now Ayushman Bharat Yojana assures. The other, Junaid, is even a program like Pradhan Mantri Awas Yojana. Now, many who have studied the impact of domestic violence on women recognize that when women own property, the propensity of such women to be subjected to domestic violence is much less as compared to women who are working. Unfortunate but true. And the Pradhan Mantri Awas Yojana, one of the greatest aspects of that we celebrate as the female workforce, is that there is an insistence of ensuring that there is joint custody of the property that is given. So when you look at implementation, and would one ministry then become the fulcrum, or rather that the Prime Minister's office becomes that fulcrum, because he has done much more for gender justice than any one ministry. One must here highlight, Junaid, that even issues like menstrual hygiene, it is the first time that that our country had a menstrual hygiene administrative protocol under a male Prime Minister. It is the first time that a male Prime Minister stood at the ramparts of the Red Fort and spoke about the ₹1 sanitary pad. So I would insist that instead of looking at the Women and Child Development Ministry, and that in fact has a bias underlined with it, that it is only the Female and Child Development Ministry that needs to think about the women in the country. We are quite blessed, in fact, and celebrate the fact that it's the male Prime Minister, in fact, who has led gender justice and spoken about the need now for India to transition from women's empowerment and women's development to women-led development.
No, that's very, very well put, Minister. Very well put, Minister. But you forgot something. There's one more element to the story of women getting married and going across and finding a national protection, which is sanitation, of course. Swachh Bharat made a very big impact in the rural area. So we've seen that women getting access to toilets has been a very important part of protection of their society, which you have enunciated in many ways.
I think that the gender discourse is such, Junaid, that given that the sanitation program had a fixed component to it, the migratory portable component with regards to healthcare, with regards to even the banking facility, or for that matter, the One Nation, One Ration card, that has been extremely significant. But yes, when you talk about Swachh Bharat, apart from the sanitary needs of women and the dignity of women, I must here flag that again in the year 2012, 13, 14, when causes were looked into with regards to women and violence, 46% of sexual assaults happened when women went out to defecate. So when you talk about the Swachh Bharat movement, there is an impact with regards to women's safety and security as well.
Absolutely, absolutely. Thank you for reminding us of that. And Kaysar, if I could come back to you, taking off from where the minister talked about portability, maybe now's the time you'd like to share a little bit on the migration story that you wanted to discuss.
So first and foremost, I think that I entirely agree with the minister and with Amitabh, and therefore I think that I'm going to suggest that this One Nation, One Ration card, which have been really applauded all over the world, can be replaced by One Nation, One Social Security card. That Social Security card, using the kind of technology that Amitabh mentioned, and looking at the number of initiatives from health, from in terms of Jan Dhan, is a multiplicity of social security measures. One nation, one social security card. The next step of graduation from merely on the issue of rations. Point number one. On migration, Junaid, we require credible data. I still do not have the data of the 2021 census. I looked for it yesterday. Hopefully it will come soon. But we do need credible data. We do need to do away with the definitional ambiguities on what constitutes migration and on the issue of circular migration. In fact, I have pleaded in my commission's report, in the section on migration, for a national commission on migration, both national and international. The Ministry of External Affairs has a very keen interest that beyond the pandemic, when Indian migrants go abroad, they need to be properly taken care of. They need to be dealt with equity and dignity, and not in merely quest of seeking a livelihood. So I have pleaded for the Constitution in the report of a National Commission on Migration. Third, and my last point is that apart from National Social Security Card 1, apart from a National Commission on Migration, we need to have on the entire issue of migration put together the multiplicity of conflicting laws, rules, and regulations. And this is something which you mentioned, Junaid, that a 21st century social security system must embrace the union and the states. The states need to become integral to this process of the National Social Security Card, of which they are also an integral component and on which also they are spending valuable resources. That will enable India to truly, really tell the world something that Madam Smriti Irani had said, that we have in multiple, that National Social Security Card will put India in the lead nation, having contemporary 21st century social security system benchmarking with the international basis.
Thank you very much. Amitabh, maybe if I could ask you to conclude on this point. We talked about federalism implicitly, and I think NK Sir has really put this on the table again. Your sense, looking at the federal system of India and social protection, do you find areas that need to be strengthened here?
Yeah. Junaid, my belief is that we have too many schemes for subsidies. You know, if you have about 370 odd schemes providing subsidization, the targeted approach will not work. You need to converge, you need to integrate. Also, as I said, it's very important that we use technology to really ensure that benefits reach the actual beneficiary. And one such powerful tool during the COVID period, actually the Prime Minister had asked us to look at how technology can be used to leapfrog during the post-COVID era. And we developed a portal, we developed a very powerful tool called Unnati. We realized that there is fragmented, very intermediary, heavy, very siloed approach to search and availability of both blue and grey collar jobs. And most existing job portals focus on white collar jobs with search for other jobs added as an afterthought. So the entire focus is on white collar jobs. And consumption of information and sophistication of semi-skilled and unskilled job seekers, and a lot of these migrant workers are unskilled job seekers. They're completely different from educated job seekers. And therefore, we developed Unnati as a technology platform to digitally enable livelihood access for close to 20 crore blue and grey collar workers in India. And it provides for ease of use. It provides for enabling flow of resources to them through just one click. And it's really been designed to serve as a master of all existing job platforms. So my belief is that the gig economy will actually be the future of work and employment. And I firmly believe that the many digital platforms that we have today and many that will come in future will help increase earning opportunities along with expanding. They will extend social protection, they will increase convenience, they will bring in greater credibility, and they will provide for greater social protection. So a blend of this kind of very, very smart high-tech apps and ensuring that we are able to cover a lot of blue and grey collar jobs, semi-skilled and unskilled job seekers, all of them, and cutting down the total number of subsidy schemes into few and ensuring that the money goes straight into their bank accounts using technology is really the answer.
Well, let me thank all of you for your thoughts. I must say that I think all of you have, in a very powerful way, made the case that today's modern economy, faced with shocks, governments must anticipate them and government must protect not only the poor and the vulnerable, but the human capital of nations. India during the pandemic stepped forward, and the programs that it took forward made a huge dent in protecting its citizens exactly in the way that you have described. But I think that India stands on a watershed moment where it truly is ready to create that 21st century social protection system. I think we heard from Minister what a powerful mechanisms that are on the ground today, that if those can be brought together in India's federal system, and yes, India's democratic and complex federal system, we will see, I think, a full global. Thank you very much for joining us, and I wish the Raisina Dialogue continued success. Minister, thank you. N.K. Singh, sir, thank you. Amitabh ji, thank you. And Shreyana, wonderful to see you. Thank you.